David Wrigley. I'm a GP in North Lancashire, near the Lake District, and I've worked there for over 20 years now. And my background is I campaigned very heavily against the Health and Social Care Bill, as others have done so. And I travelled up and down the country trying to explain the dangers. And as you said, Tony, even wrote a book with Jackie Davis and John Lister, and that's still there, out there, called NHS for Sale. It's still relevant, and all the profits still go to keep our NHS public, which we're really proud of. So do look out for that book, NHS for Sale. I'm speaking today on behalf of the British Medical Association, and the BMA is the trade union representing over 160,000 doctors and students. And very recently we debated at BMA Council, and I'm the Vice Chair of BMA Council, we debated a motion to oppose the new Health and Care Bill. In fact, it was just 2 days after it was laid in Parliament, and overwhelmingly BMA Council, which represents the whole profession in the UK, voted to oppose the Health and Care Bill, a really significant move. And that now means that we'll be campaigning and trying to explain to patients, the public, to colleagues, what the dangers of that bill are. And you've already heard some of the good reasons for that. I'll just relay some of the BMA's main concerns. Our strapline is that this is the wrong bill at the wrong time. And that's really important, because we've just gone through a pandemic. We're still going through a pandemic. We don't know what's ahead of us. And we're having a wholesale reform of the NHS when my colleagues are certainly on their knees, both after working in the pandemic and the huge backlog of care that's been created. So it gives very little time, and it's been rushed through Parliament as well, very little time to discuss and scrutinise the details of the bill. The bill, too many areas in the bill lack any clarity over what it would achieve, why it's needed. It doesn't result in any effective change, and certainly doesn't bring about what we want to see as Keep Our NHS Public activists. And we strongly believe the bill needs significant amendments, even if it is to get close to what we need. And we will be pushing for amendments, because we know what the political reality is here, with a government with a significant majority. So we're going to push hard for some amendments, but still oppose the bill, because that's important. But we need to explain what's wrong with it. And as you've heard before, the BMA was long against Section 75, which was introduced in forced tendering of contracts, and we wanted to get rid of that. Now they've said they're doing that, and they think that's fantastic. But in actual fact, as we've heard, it just means that contracts could actually just be handed out to friends and family, as we've seen during the pandemic. And we want the NHS to be the first provider of choice, to get the first bite at the cherry for any contract. And if they can't fulfill it, then it can go elsewhere. But that's our aim, to push for that. So that's one of our main concerns around contracts coming up for renewal, not going out to tender, but just being handed over to friends and family. Another really important aspect for us actually is clinical leadership. We want doctors on the ground to be involved in how healthcare is overseen, how it's contracted and commissioned, rather than undertaken by remote, faceless bureaucrats in ICSs, integrated care systems. There is some semblance of saying that they want a doctor involved on the board, but it's just not good enough, and we don't see that it's adequate as it is now. We have good representative structures called local medical committees for GPs and local negotiating committees for hospital doctors, and we want them to be able to sit on these boards. They know what it's like on the ground. And as I've just seen with the pandemic, we want public health to be heavily involved. So we're pushing for directors of public health to also have a seat on these boards, which is really important. And of course, we need the patient voice in there. Another aspect that really worries us is around workforce. It's shocking to see the shortfall in numbers now. We've just done some analysis recently. We think that about 50,000 full-time equivalent doctors short in the NHS. And this is why waiting lists are rocketing, why GPs are getting so much anger around not being able to see a GP, because there just isn't enough of us. And the government are quite happy for doctors to take the flak for this, but it's their incompetence and lack of planning that has brought this about. So we've actually sought to lay some support. We sought support and got it from other organisations, the RCN, RCP, Royal College of Physicians, the King's Fund, to amend a clause that will place a duty on the Secretary of State to put a report to Parliament with an assessment on workforce numbers, so that they are accountable for this lack of staffing, and we can then point the finger in the right place. Just one other aspect I'll talk about before I wind up, Tony, is around the powers of the Secretary of State, and that is really concerning. The BMA supports clear lines of political accountability for the Secretary of State, but that power must be balanced with responsibility. And we're really concerned that this bill focuses much more on giving the Secretary of State powers without any accountability. So, political choice will occur rather than what's right for patients. So we're calling for clear safeguards and limits on the use of those powers to be included in the bill, as well as a reinstatement of the duty of the Secretary of State to provide secure and comprehensive healthcare. That was lost in the last reorganisation that we had to endure, and we want to bring that back. So those are the main headlines that we will be campaigning on. We'll be producing materials, we'll be doing social media, trying to get our doctor colleagues around the country to talk about this and engage with patients and MPs to seek change. So, the NHS is at the heart for all of us, and doctors want to see the best possible care. It's been a dreadful 18 months. We have seen an announcement of new funding, but very little by the way of any plans. And as I say, the waiting times are just horrific now. My patients are waiting over a year just for routine care, and that is just unacceptable. So let's carry on pushing together. Please join the BMA in its campaign. Look out for our materials, share it. Please do contact me. I'm more than happy to talk to you or email you. I'm on Twitter under David G. Wrigley, and I wish you all the very best. And thank you for inviting me, and I look forward to hearing some of the other speakers. Thanks, Tony.